Hey, hello, hello. Hey, even if you have told someone that you are planning on speaking on 8:55, we've got a sign-up sheet on the podium. If you would make your way up there and sign in, and I think there's a spot that says for or against. If you're neither, just let us know. Um, so even if you have told someone that you are speaking, I still need you to sign up because that's what I'm going by. Hey. Okay, it's time to start. I'm gonna ask Representative Amati if he would open us in prayer.
Thank you, Mr. Chairman. Let's all assume a position of prayer. Father God, thank you so much for allowing for us to be here in your midst, that we are here to do the will of the people, that we are here to do it compassionately, in earnest, be able to reflect on all that you have placed upon our hearts. Please allow for us to have a clear mind and allow for us to receive all that we must in your most perfect will. In your name, Jesus, we pray. Amen.
Thank you. We are industry and labor is now in session. The first bill, the author is not here, but just to give some, I know most of you are here on another bill, House Bill 389 by Todd Jones, which was a dealt with misclassification, specifically on W-2s and 1099s, passed out unanimously by this committee. Bill was late in session. It got the rules and did not get out. So at this point, we're not gonna hear the bill, but I will entertain a motion. Representative Pruitt.
I'll make a motion, do pass.
We have a first, second. All in favor, say aye.
Aye.
All opposed? It is on to rules. Thank you. All right. Should do all bills that way. We are on to House Bill 855, and I'm going to ask Mr. Kennard if you'll go to the podium, and then so did everybody that wanted to speak. Okay, I got you. Okay. Thank you. Okay. I'm first going to ask Ashley Wilson from the Gwinnett County Police Department, if you would please come forward. Well, before I do that, I'm sorry. Greg, tell us about your bill. And I think everybody's got it. 855 LC 364883.
Conversation about mental and behavioral health this year. We're attempting to move past the many stigmas surrounding the subject and bring to light the conditions, diagnoses, and diseases that inflict so many of our citizens. Fundamentally, we must understand that mental health is health. The brain is an organ of the body, just like our heart or kidney, and is susceptible to injury and disease. What HB 855 intends to do is acknowledge that our first responders, those courageous men and women who commit to serve as law enforcement officers, firefighters, paramedics, and other frontline roles, are more vulnerable to PTSD and other forms of psychological injury than most because of the nature of their work. Almost every day, they are walking into life-threatening, dangerous, and traumatic situations, seeing firsthand things that the average person will never witness, things that cannot be unseen, hearing things that cannot be unheard, and they're affected by these extraordinary experiences. HB 855 seeks to make room under our workers' compensation code for PTSD when experienced directly as a result of the job to be a compensable claim. Currently, it can be covered if accompanied by a physical injury, but not as a standalone occurrence. In our mental health conversations around the Capitol, we are hearing the term parity as one of our new initiatives in Georgia, is that we are seeing the importance of treating mental health with the same measuring stick and compensation structure as a physical health injury or condition. HB 855 aims to bring parity to workers' compensation. PTSD would be treated the same as breaking a limb, being shot, third-degree burns, or any other on-the-job physical injury. It would have to meet the same burden of proof, clear the same bar, meet the same scrutiny as any other physical injury claim. Some would argue that you cannot see psychological injury. I would argue that depends on who's looking. Mental health professionals are trained to assess and diagnose mental health conditions. Inspire Outreach, the organization that I oversee, we work with the homeless and have a therapist on our team who does just that. Upon entering our residential program, individuals are professionally assessed, a psychiatric evaluation performed, and within just a short amount of time, they're able to determine if the individual needs services, support, treatment, medication, or nothing at all. It can be done and is done all the time. As you will hear from several first responders today, this measure is desperately needed. We need to create a culture in Georgia where these brave individuals feel supported and confident that they can be honest about their mental and emotional state. Most cannot be honest right now out of fear of being stigmatized, being labeled as weak, in fear of losing their job, or not being considered for promotions because of the questions of them being fit. So most simply stuff and repress, and there is consequence to this culture of silence. Police officers are more likely to die by suicide than in the line of duty. We need our law enforcement officers, firefighters, paramedics, and all who serve in this capacity to be healthy inside and out to serve our communities well. I'd like to bring your attention to the fact that this is a bipartisan supported and sponsored bill, equal parts Democrat and Republican. I want to thank Ashley Wilson, Corporal Ashley Wilson, for bringing this to my attention. I also would like to thank Sean Marie and Legislative Council for helping us craft this legislation. If you look at the bill, I'll quickly cover it. Section 1 is basically unaltered. Leg Council took advantage of this opportunity with the bill in hand or the code in hand to clean up some language. But lines 36, 37, 38, you'll see where we now include post-traumatic stress disorder to be included as an injury or personal injury as provided in Article 8A. Let's move to Article 8A in Section 2. Part 1 defines who a first responder is. Part 2 defines what a psychologically traumatic event. It's when it's witnessed visibly or audibly, an occurrence of serious bodily injury as a result of accident or intentional act. Also, if someone audibly and visibly and or witnesses a death as a result of a violent act. Section 3 classifies it just as public servants as first responders. Private first responders companies would not be covered in this code. Subsection B defines how a post-traumatic stress disorder could happen. It would be presumed that would arise out of a course of employment. Subsection C gives an opportunity for there to be rebuttal. If there was a pre-existing PTSD diagnosis, many of our law enforcement officers served in the military, so maybe there's a carryover. This would be covered if it was seen as an aggravated, continued aggravated occurrence if it was occurred on the job. Subsection D. It identifies that this can be a standalone injury separate from a physical injury. Subsection E. This can be diagnosed within 3 years of the original trauma. And then subsection F says that this would go in effect and would be traumatic events experienced after July 1, 2022, if it were to go into code. That's all my remarks now.
Got a couple of quick, one question and one clarification. I was trying to find it. On firemen, is there a distinction between volunteered and paid, or that does not matter?
Can we defer to Sean?
Okay,
Thomas?
yeah, and we can come back to that. Okay. Because we've got a lot of people. And then just to clarify for other folks, so on regular insurance, if there's an injury, even if it's really minor, if you nick your finger on the job and then you develop PTSD from that same event, it's covered. But as current law is now, if there is no physical injury whatsoever, it's not covered. That is the big distinction, correct?
That's correct.
Okay. And is that true with regular insurance and or workers' comp? Is it the same with both or just workers' comp? Do you know that?
I'm not sure.
Jean Marie? About if there's an injury, it is currently covered under workers' comp, correct? Even if it's a quote minor physical injury.
Well, I would defer to the workers' comp to answer that question, but you are required.
Okay, that's what I thought. And that really, okay, that was not a question, much as clarification for everybody. If there is a physical injury, even again, if it's a nick of a finger, but you develop PTSD as a result of that, the coverage kicks in. Okay. And speaking of Ashley Wilson, I didn't see any questions. And I'm going to try to move quickly because we've got a lot of people and we're supposed to be out of here by 4. So Ashley Wilson with the Gwinnett County Police Department, please come forward. Tell us who you are, your title, and then go ahead.
I'm Corporal Ashley Wilson. I'm a police officer with the Gwinnett County Police Department. My journey to stand in front of you has been 3 years in the making. On October 20th, 2018, I held my partner's hand as he took his last breath after being shot 6 times in the most horrific and gruesome scene I had witnessed in over a decade of policing. In the months and years to follow, I became a shell of a person that I once was. I went from being an Ironman triathlete to someone who struggled to get off the couch and brush my teeth. Nightmares plagued my sleep, and during the day, I suffered debilitating flashbacks that were so vivid I could taste the metallic sweetness of blood. At my darkest hour, I sat with my duty pistol, ready to relieve my family of the burden I thought I had become. But now I stand before you today, happy and healthy, because I found treatment and got the help I so desperately needed. But it did not come without a cost. I've accrued thousands in medical debt and exhausted every hour of accrued leave I've earned to find what I call a new normal. While I'd like to say that my scenario was unique, it's not. Across the state on a daily basis, first responders are called to serve their communities and put their lives at risk. They will engage in situations that their eyes cannot unsee and their minds will never forget. Citizens will see these everyday heroes as superhuman, and our resilience will mask the mounting toll these professions take on our mental health. But we as a society can no longer keep putting the burden on them to carry. Setting aside that no Georgian should face financial ruin over a health issue, certainly our first responders shouldn't have to decide whether to live or to have a place to live. House Bill 855 will help alleviate the financial burden that is often a barrier to first responders receiving care. The need for this bill is profound, but you don't have to take my word for it. The 2015 American Psychology Association Journal article stated, like physical health care, we believe the evidence is clear that the integration of mental health coverage into the workers' comp insurance system is not only cost effective for employers and insurers, but will provide relief for workers and hasten the return to work. In the absence of a federal mandate, we believe that these issues should serve as a call for organized legislative efforts to achieve these goals. The federal 2008 Mental Health Parity and Addiction Equity Act calls for health plans insurance policies to provide mental health benefits that are equal to the medical benefits they provide. And in a nutshell is what we are asking for with this bill. Treat a mental health injury in the workers' compensation system the same as any physical injury, because mental health is health. Recognizing and addressing the profound effects of trauma on the first responders is one of the most fundamental steps needed to facilitate healthy and safe interactions between first responders and their families, their peers, and the communities in which they serve. Recent social unrest has demonstrated how dangerous it is to ask first responders to repeatedly expose themselves to traumatic situations without equipping them with the mental health support necessary to sustain that exposure. The average response time for a first responder to arrive at the door after a 911 call is just 4 minutes. And we are calling on you to respond to our call with the same sense of urgency. Thanks, sir.
Andrew, tell us who you are.
Good afternoon. My name is Andrew Wilson. I am the husband of Ashley Wilson, and I currently work with the Department of Agriculture as an emergency management specialist. House Bill 855 will save lives. As a 20-year Marine Corps veteran with combat experience in Iraq, I've seen firsthand repercussions for Marines who are unable or unwilling to seek mental health treatment because of the associated stigma, financial constraints, lack of resources, and lack of concerned leadership. The veteran support community has been forced to make improvements, and even then, we struggle with the rate of veteran suicide deaths that are 50% higher than that seen in non-veterans. I bring this up because our nation's first responders are facing the same crisis. We can't fix the issue across the country, but we can fix the issue within our own state. Our first responders have seen and heard things that no one should ever have to experience, but they do. Day in and day out, they continue to show up and do their jobs, and the images and sounds that their brains capture continue to build. I know this because the stories my wife has told me that makes my experiences in Iraq pale by comparison. When the level of mental trauma became too much, she made the choice to seek out mental health treatment. In seeking that treatment, and even with the benefit of having 2 major insurance plans, we have accrued over $20,000 in out-of-pocket medical expenses, as well as my wife exhausting all of her accrued leave time, and none of that can be recouped even with the passing of this bill. To address this issue, my wife has made great strides over the last 6 months to bring attention to the ongoing lack of support for our state's first responders and their mental health, specifically the diagnosis and treatment of PTSD. Her efforts have brought about the drafting of Bill 855, which will amend Georgia's workers' compensation law to provide relief for first responders that seek mental health treatment. We have painfully learned firsthand that first responders must use their own accrued leave and pay for treatment through their department insurance plans and/or out of pocket. Many first responders do not have that luxury. The situation is beyond acceptable given the increasing pressure that our first responders face today. For our first responders, sadly, another year has passed where suicides have outpaced the line of duty deaths across all first responder professions. We as a state and you as our representatives must work together to begin to fix this. You have before you an opportunity to correct this issue. House Bill 855 will save lives. This is not a Republican or Democrat issue, and allowing party lines to interfere with its passing would be callous and unprofessional. Additionally, the potential cost of expanding the workers' compensation program to include the mental health treatment for first responders is negligible when compared to the benefits of providing the opportunity for treatment and recovery for those impacted in our first responder community. We as a society and you as our elected officials owe our first responders the utmost support for the jobs they are asked to do in the situations and environments found in today's communities. The partisan divide must be bridged to ensure that there are fewer barriers for our first responders to get mental health treatment. House Bill 855 will remove one of those barriers. Thank you.
Thank you, Andrew. Chad Black.
Chad Black. I just retired after 40 years in fire EMS and air medical. I currently chair the State of Georgia EMS Association and also the Lieutenant Governor's appointee to firefighter standards and training. Everything that's been said before me, I totally agree with. Outside of COVID in the last 2 years, I've never seen anything in my 40 years that's taken more lives of our public safety people and people I know, personal experience, than suicide from this illness. You're going to hear from someone shortly about their father that unfortunately he committed suicide at one of our conferences. I saw him the day before, and the next night I helped bring him down from a hotel room where he hung himself, me and 3 other firefighters. Just recently, 3 weeks ago, a prior fire chief that I worked very closely with that had worked Fulton County and retired from Banks County, law enforcement, for unknown reasons, chose to go out in his pickup truck, take a firearm and kill himself. And nobody, even his wife to this day, we don't know why. I had one of my own employees 3 months ago that she did experience no signs, showed nothing that she was going through anything, took an overdose and tried to take her own life. Thank God she survived. We got her help and the county stood behind her, paid for that help. But many departments, that doesn't happen. And it's time something's done. This has become an epidemic, just like COVID and many other things in our society. So I ask you that you get this bill through. It's much needed. I'm out of the business now. I'll still stay active and fight for these type causes. But personal experience outside of COVID, I've not seen anything that's taken more lives of our public safety professionals than suicide in today's time. Thank you.
Thank you, Chad. Dr. Tina Jackal.
Good afternoon. My name is Dr. Tina Jackal, and I'm actually here to provide a little different perspective than the firsthand from the powerful stories you're going to hear. I am a licensed clinical social worker in the state of Florida, and I actually recently became licensed in the state of Georgia. In fact, one of the biggest reasons is because of the crisis that you're facing here with your first responders. I have been boots on the ground for 22 years, working solely with first responders on all levels, from the Federal Bureau of Investigation, U.S. Marshals Task Force teams, to countless state and local agencies. I will tell you, you are in a crisis state, okay? I am hopeful that this bill will do several things. One is bring awareness. I was part of the drafting of the now Florida statute 1112.1815, which is essentially the same bill that you have here. And any concern that there will be an abuse of the system by those raising their hands and saying PTSD, I have PTSD and I should be compensated by it, is unrealistic. We do not see an overwhelming problem with Florida in terms of the abuse of the system because there are stopgaps in place. The first is you must be formally and clinically diagnosed with post-traumatic stress disorder. And that is a big step here. The other is that you will gain a much better morale. You're going to gain people who will get treatment and stay out on the street, stay as first responders, and not lose that incredible amount of experience. I am very passionate about this. I have seen way too many people fall through the cracks. I hear about suicides of first responders almost on a daily basis. So I implore you, please, and I want to just leave you with a quick story. I'm also the EAP provider for the Jacksonville Sheriff's Office in Jacksonville, Florida. We are the 25th largest agency in the nation. We have 1,800 sworn officers on the street and 650 corrections. Those are my folks. I had an officer come to me very recently who was struggling with post-traumatic stress disorder. He was terrified to come get help. But once he knew what he was dealing with, and once he received the diagnosis, he was able to face it, confront it. I was able to normalize what he was going through. At the time, his marriage was failing. His kids are alienated from him, and all of this stemmed from the trauma of having to carry a deceased 1-year-old out of a house fire. Okay. and he could not get this out of his brain. Most importantly, it should be as much a part of a physical injury. Mental injury is very real. And at the end of the day, post-traumatic stress disorder is not about what's wrong with you. It's about what happened to you. So thank you.
Thank you. Butch Ayers.
Hello, Mr. Chairman and committee members. Thank you for allowing me this opportunity to appear before you concerning House Bill 855. My name is Butch Ayers, and for the past 2 years, I've served as the Executive Director of the Georgia Association of Chiefs of Police. Our association represents more than 1,000 chiefs of police, command staff members, and executive members across the state of Georgia. And prior to my retirement at the end of 2019, I spent 35 years with the Gwinnett County Police Department, including the last 5 years as the Chief of Police. And as was said before, currently in the state of Georgia, PTSD is not covered under workers' compensation unless there is an accompanying physical injury. So when you look at that, if a police officer gets out of his police car in the parking lot of the police station, trips over the curb, suffers a broken ankle, that is covered under workers' comp. If a police officer witnesses a violent and traumatic event or is involved in a violent or traumatic event, only sustains a psychological injury, PTSD, that is not covered under workers' comp. During my research regarding workers' comp for PTSD, I've discovered that there are only 9 states across the nation that cover PTSD psychological only injuries. 28 states cover PTSD psychological only injuries in limited circumstances, such as sudden or unusual incidents or just with first responders. And the 13 remaining states, including Georgia, do not cover PTSD psychological injuries at all under workers' comp. So Georgia does have some support for some of those that may be suffering from a psychological injury. We have the Georgia Officer Resiliency Program initiated within the past 2 years by Georgia Post Council. They provide training and peer counselors on how to assist fellow employees. There's also the Georgia Department of Public Safety's Office of Public Safety Support that can assist officers and agencies after a traumatic event. But once an employer's or employee's sick and vacation time is gone, the employee is suffering from PTSD is left in a tough position. They've lost wages, they've lost time, they've incurred medical expenses and other benefits that are afforded to those under workers' comp if they have suffered a physical injury. I think we can do better, and we owe it to our first responders to do better. That concludes my comments. I'll be glad to answer any questions.
I've got a question, just to clarify. You're saying 9 states have unlimited coverage. 28 have limited.
Limited.
And then when you said 13 states do not at all, but of those, like Georgia does cover if there is a physical
no.
injury.
I'm talking about specifically covering psychological injuries.
Gotcha, as a standalone injury.
Correct.
Okay, all right, thanks. Any other questions? All right, thank you, Mr. Ayers. Jason Teague.
Good afternoon. My name is Jason Teague. I'm a lieutenant with the Gwinnett County Police Department. I have served with my agency. Sorry. My name is Jason Teague. I have served with the Gwinnett County Police Department for 26 years. Currently, I am the command element for our SWAT team, and I'm also the assistant academy director. I, like so many others, have seen the ugly side of law enforcement. I have been forced to, in my career, to unfortunately apply the highest levels of force to save lives and my own as well. The men and women who choose this career have chosen a righteous path to serve this state and their communities. They deserve to have this state and those same communities serve them and their families in their most desperate time of need. The empty rhetoric that first responders always hear about support and caring for us has to stop. Unfortunately, many times this rhetoric comes at the loss of a life. We see it on TV, we see it after a funeral. That is when we get this outpouring of support. We need that support now. We as a profession cannot predict how anyone will respond to the aftermath of a critical incident. And as of now, there is no real long-term support mechanism. that doesn't include a financial burden that these men and women should not bear. Their families should not bear this cost either, financially or emotionally. Without a doubt, there are quantifiable moments in a first responder's career that create PTSD. Instead of focusing on those that some may feel would abuse this help, we must see the true nature and desire of this bill to help our servants receive the treatment that they deserve. To many, the mere prospect of having to pay for the help that they so desperately need very well can lead to not seeking that help just because of the cost alone. As a leader in my department, the command element of my SWAT team, and the assistant academy director, I have a responsibility to prepare the men and women of my department and my team for the worst that could happen. I obviously do not take this duty lightly. With all I have, I pour into them. I try to develop them physically, tactically, in an attempt to ingrain mental fortitude using my past experiences and training. But in the end, we have no real safety net to catch them if they one day face that single call, or after enduring years of trauma, seeing the ugly side of serving their communities. I do not have a tool to prepare them for, a tool to prepare them for what could happen in the aftermath. That is training that as a department we don't have, that as an instructor or as a 26-year veteran, I don't have the ability to provide that help after the fact. We can no longer accept that the best training or best equipment alone are enough to carry our first responders through traumatic events. These things or tools do not help them once the mental trauma has taken its hold over our men and women who serve. The lack of a legitimate long-term support that, like any other injury, which should be covered in an effort to bring them back at a minimum to the workforce and maximally to save the lives and not destroy their families. There is also a cost that many do not realize, and that is one that is paid by the citizens we serve. At this time in our country, where people demand and deserve a better trained, better educated, better prepared public servant, we're losing our first responders because of a lack of mental health support. This diminishes the workforce, and in turn, communities are left facing manpower shortages, less effective first responders who desperately face each shift carrying a burden that makes them less effective. Our communities, in turn, suffer when our first responders are not at their best, physically, and I believe more important, mentally. In your worst moments, your family's worst crisis, you do not get to choose the police officer, the firefighter, paramedic, any other first responder that shows up. You do not get to pick that person. Our communities, you do not get to pick that person. Who do you want to be responding to you and your family's crisis moment? The person that moments earlier may have been sitting there contemplating taking their own life, or the person that is focused, mentally sound, physically prepared, and ready to answer the call. The selfless call to serve and protect by giving you their best. Thank you.
Thank you, Jason. Hold on, Jason. We've got a question. Representative Pruitt.
Okay, thank you so much. And I don't know if this question is specific for you, and in the interest of brevity, because it looks like there's a lot of people that want to speak, I just want to make this quick, but maybe if you don't address this, maybe somebody subsequently
Yes, sir.
can. It sounds like I'm hearing that there are paths and capabilities of supporting people's mental health, but there's a lot of people falling in between the cracks from different types and flavors of first responders, if I'm hearing that correctly. So we don't have an all-encompassing kind of way of handling this, and that's what we're trying to address in this kind of situation. Is that safe to say?
The best answer I can give you is there are paths, but they have to be taken upon by the individual. There's no other support mechanism other than they choose to seek it. They have to pay for it. That's it.
Yeah, but is it safe to say like some departments or aspects do have that capability of supporting them?
Most agencies probably have an EAP program, but it is very limited in scope, and it usually does not also cover helping the families who are also suffering from the same trauma.
So maybe a rural department or something like that doesn't have that capability and those types of support, and this would fill the gap.
That's a fair assessment.
Okay,
Yes, sir.
I got you.
Don't go anywhere. Representative Hill.
That's all right.
Yeah.
Send it.
Just a quick question. Are there any type of requirement that you see or you have in your program that requires an individual who has experienced one of these traumatic situations where they bring them in after that and talk to them or to help them go through
So-
this?
As an example, if you're involved in a deadly force situation, you will be required in my agency to go basically have an evaluation done by the on staff or the clinical psychologist or or the doctor that will clear you to come back to work. But it is within a week or two of that incident. The long-term effect down the road, there's nothing standing there waiting for you to come back and see that without you having to pay for it out of your own pocket.
One other question. So there's no requirement of a follow-up, say 3 months, 6 months?
No, sir.
Down the road?
No, sir.
Okay, thank you.
And but that's your department. So back to Representative Pruitt's point, if you're in a rural setting, you might not even have the first initial setting, correct?
And I can
Okay.
give you a very specific example that ironically occurred last night after I hit a deer with my patrol car. I met with a deputy that works in a rural agency to come work the wreck, and we got to talking. In November, he was involved in a very bad critical incident where he was there when his partner was killed. They have no requirement. He was not required to go see anyone. He was not required to get clearance to come back to work. It was just a few days later, are you ready? Come on back to work. Now, he chose to do it on his own, but as a department, not too far outside of Gwinnett County, it was definitely, there's no requirement.
Okay, you've got a question from the author, Representative Kennard.
Just an observation to the question. Thank you. Most of what's available out there for first responders in terms of programs, funding is just simply peer support, which is powerful. First responders being able to share their stories and get emotional support from there. But it's grossly inadequate because there needs to be psychiatric services, perhaps treatment, medication for the long term. So peer support is powerful, but it's just not enough.
Okay, and then Representative Almaty.
Thank you, sir. Thank you for, first, thank you for your service
Thank you.
overall. Thank you for being able to come here and provide it. I'm curious, with this bill passing, should it pass out and become a law and funding will be provided, in law enforcement circles, how can this be communicated in a sense to where officers feel that this is something that they will naturally be able to take on without the connotation that if they take this on, that they're somehow showing weakness?
Well, it's a very sort of broad scope answer, but I would say, like was stated before, bringing awareness to the table and letting people know that it is okay to be in these crisis moments and you have a support mechanism. You're not going to be shown. I believe just the mere fact that they know it's there, it's discreet, that they will seek it out. I believe one of the biggest reasons it's not sought is because of the financial burden, period.
Thank you.
Okay, thank you. Better run while there's no lights on. Brandy Cook.
Hi, I'm Brandy Cook. This is my mom, Anita Poole, so we want to share our family story. Let me start by saying thank you for taking the first steps in helping us to provide the support that our first responders need. We are so proud of all the men and women who've been able to beat the PTSD battle. Mental health is so important and PTSD is real. And I can guarantee the scenes and images that our first responders have experienced are things that we can only imagine are nightmares. Our first responders are experiencing PTSD at an all-time high. In fact, suicide rates among first responders is found to be up to 5 times higher than civilians. So I'm going to share our family story. I'm going to share a story about a young man, father, brother, and dad who lost his battle to PTSD too young. Chris Baggett began volunteering in the fire department at the young age of 18. He realized his passion was helping others. He worked for Gwinnett County Fire Department for 21 years. He had a dream of making it to the top of the ranks in the fire department. He was cross-trained as an EMT, became a truck driver, lieutenant captain, and finally a battalion chief. He was only 39 when he was promoted to battalion chief. Through his years on the fire department, he told so many stories. Some were funny, others were sad. Unfortunately, there are a lot of stories that he refused to share the full extent because he knew how much they affect him and he didn't want anyone else to have the imagery in their heads. And the holding of the stories and feelings is where it all begins. At the beginning of 2019, my brother moved in with me when he was where he remained the last 4 months of his life. During his stay with me, he talked about how unhappy he was. He was living with me and we barely heard from him. He was always in a dark room. In May, that's when he was promoted to battalion chief, and we couldn't have been prouder. But Chris, who had dreamed of rising up the ranks of the department, didn't seem happy about his promotion. On the outside, he looked as though his life was everything he ever wanted, but inside he was falling apart. His passion and light were slowly burning out. His smile faded. Pictures he stepped to the side. The jokester we knew was disappearing. The man was slipping away. He left his TV on at night so he could drown out the thoughts and the flashbacks. The images and sounds got louder at night. He talked about his ears burning, which we never understood, and the screaming of the child he could not save. We later learned in training that firefighters are taught that their ears begin burning under the flaps of their helmet and they need to turn around and get out. Anyone on the other side's already gone. He was having flashbacks to those moments. And here's a couple of things that happened over the last 6 months of his life. He spent hours upon hours on the phone crying and talking about how his life was. He thought his kids hated him. He was a burden to everyone. There was no God. He had no friends. When he was asked if he could live for his kids, he said, "I don't think I can." He was closet drinking and self-medicating with alcohol. He was giving away memorabilia, not accepting gifts, could care less about the amount of money in his bank account, and giving back childhood pictures. He started working from home, taking time off work, and constantly late. He lost weight, and he made comments, "If I want to commit suicide, I'll go where I can't be found." All of these are just examples of how bad his PTSD had gotten. But here's a few things that he said I want to ensure that you hear and understand why this bill is so important. He said, "I want help, but I cannot reach out to the fire department. I'll be labeled and I'll never have a career I want. I don't have the financial means nor the time to take off work to get help. No one understands and they don't know what it's like to have PTSD." In September of 2019, my brother was an uphill swing. He was an all-time high. Even his coworkers and partners had mentioned how happy he was. We had my brother back for a total of 2 weeks. He left on October 4th of 2019 for an EMS conference in Savannah. That was the last time I heard from him. I was awakened by a phone call from my mother at 11:33 p.m. on October 7th of 2019 that my brother had taken his own life. Could you imagine hearing people screaming when you tried to sleep? Could you imagine reliving violent, horrific car accidents and fires over and over again at night when you wanted to be focused on your kids? Well, unfortunately, our first responders deal with this on a daily basis. We don't provide enough support to help them process through each call they go on. We are putting young men and women in situations that we've only seen on TV and then expect them to work through in a matter of days without counseling. These departments give a debriefing after horrendous calls, which may last for an hour, and then these men or women expect to just go on about their life. How can a few days of bereavement and an hour conversation help people work through the nightmares and imagery? We expect these men and women to be superheroes and forget they are human too. Their brain functions just like ours. And when they experience such tragedy on a daily basis, they need healing too, just as if they had broken an arm. So we stand here today to challenge you to make a difference. This bill will give others the opportunity to get the help that they need so their families do not have to experience the tragedy that our family did. These men and women risk their lives every day for us. This is our time to stand up for them and save them. Remember, the life you save today is possibly the life that saves you tomorrow. Help us help our first responders so that no one is left hugging a pillow made out of their loved one's uniform. Thank you again for letting us share your story.
Thank you for taking the courage to do that. No, that was hard.
Thank you.
William, is it Caraway, Laraway? Okay, on Zoom.
Can you hear me?
Yeah, yes, go ahead.
Thank you. Good afternoon, Mr. Chairman, representatives. Thank you for allowing me to speak today. My name is Will Warahay. I'm a workers' compensation attorney with Hasner Law, a member of the Georgia Injured Workers Association, and I represent injured workers in our state. I've worked in workers' compensation law in Georgia for over 10 years. At the beginning of my career, I represented employers and insurers, did that for about 7 years. For the last 3 years, I've represented injured workers. So I've seen the good, bad, ugly of all sides of our workers' compensation system from both sides. I'm speaking today as a member of the Workers' Compensation Bar in support of this bipartisan bill, House Bill 855, to provide mental health to our first responders. And I just want to start by thanking the co-sponsors of the bill for taking the time to put this forward to help improve our workers' comp system. As we've already discussed today, and as Mr. Chairman, you talked about at the beginning, our current workers' compensation law does not cover mental health injuries alone. In order to have mental health issues covered under workers' compensation, it must be accompanied and a result of a physical injury. So that means a first responder, as we've already heard about today, who witnesses a murder, a suicide, violent harm to children. Without an accompanying physical injury, their trauma is not covered. I understand it's a priority of the Speaker of the House and a bipartisan goal to help improve the resources available for mental health in the state of Georgia. And I think this bill would be an excellent step in that process. So in support, I want to make essentially 2 points from my perspective as a lawyer in the workers' compensation field today. First, there may be some concern that if passed, every first responder will come out and claim a mental health injury. I can assure you that you can trust the workers' compensation system to handle that properly. We have a finely tuned system. It's been around for over 100 years, 102 to be exact. And every workers' compensation claimant has a burden to prove their case. And I'm here to tell you as a former defense attorney that if there's any possible defense, any legal argument, there are plenty of insurance companies who will assert those defenses, which is their right to do so. Our system requires an injured worker to prove that they are both, their injury arose out of and occurred in the course of their employment. That same standard applies to this bill and to mental health injuries for first responders. So our first responders would be required to meet that same burden that already exists in our system and must present medical evidence to support their claim. In workers' compensation, employers and insurers are required to have something called a panel of physicians. It's essentially a list of doctors that an injured worker can choose from to receive treatment. This same procedure would be in place for the mental health injuries as well. So all business owners, police departments, medical facilities, what have you, would have that list. They'd have mental health professionals on it that they would get to choose. So employers would still have that control, which already exists under the law, to choose which doctors or which professionals they can see. In short, I can assure you that the system is ready and could handle those first responder claims and handle them properly. My second point is about implementation. In a lot of ways, the implementation process would be fairly easy, primarily because under the way the law is written, the way the bill is written, it requires a first responder to experience a psychologically traumatic event, which is clearly defined by the bill. And because we're talking about first responders, these events will be relatively well documented. You'd have medical records, police reports, the like that would document whether or not these events occurred. This is different, of course, than your run-of-the-mill employer. As an attorney, I can tell you that most businesses, your average business doesn't have that same type of documentation that our first responders have, which would allow us to be able to implement this rule, litigate the issue if needed, and have the documentation needed to properly enforce the rule under the law. Along the same lines, as we've already heard today, we have to trust our doctors and medical professionals. No different than an orthopedic injury, an injury to your vision, your hearing, concussions, neurological injuries, all of which are currently covered under workers' compensation. We trust our doctors to diagnose and treat those injuries. We have to do the same for mental health injuries and mental health issues. As you've already heard today, and I'm sure we'll continue to hear, it's no secret that mental health cuts first responders most directly and most dramatically, almost on a daily basis. There's really no downside here. It's really not a political issue. This is only help, support, scaffolding that we can provide to our first responders to ensure they're protected and that they have resources available to them. For those that this bill impacts, it is significant. It's potentially life-changing and life-saving. So thank you for your time. I'm glad to answer any questions that anyone has.
Okay, thank you. Next, Dan Niffen from, okay, sorry, with two. Okay, sorry, come back. Chairman Carpenter.
Yeah, so just as I'm listening through this process and I understand the gravity of the situation, obviously my concern is the litigation piece for this issue. I don't think anybody in the room thinks that we don't need to come up with a solution to help these people get through these traumatic events, but it is a industry that has a lot of traumatic events. And so my fear is that locals, city, state, government is going to be on the hook for litigation on workers' comp claims for folks. So what do you foresee that looking like in your mind if this bill should pass?
Sure. I think my first point to that would be that the workers' compensation system, the way we have it set up, is a very efficient system. We are on 30-day hearing calendars. If there is litigation, cases move relatively quickly within 3 to 6 months, depending on the type of claim. So it's not like more general personal injury claims that sometimes can get drawn out for years or more. Certainly there are exceptions to that in workers' comp, but on average, in general, it's a very efficient system. So I just wouldn't have that many concerns about that because of the efficiency that's already built into the system that we have.
I would agree with you in the private sector, but unfortunately in the government sector, I think this past budget, we just are about to vote on here in the next couple of weeks. There was $150 million worth of settlements that the state of Georgia had to settle on workers' comp claims. So unfortunately, I don't think that the workers' comp avenue in government is quite as efficient as what we see in the private sector. So I am concerned. I have concern from that standpoint. As far as wages, while we're getting through the issue, I don't have a problem at all. It's just, for me, it's the fear of settling. I can't work in this industry anymore and settling out in the litigation process. And obviously that ticket goes up the longer it sits out there. So that's just my concern. I appreciate you.
Sure.
All right, because of time, we're going to move on. We've got three more. I've got two on the list and then one that's been added. Dan Niven, come on up.
Thank you, Mr. Chairman, members of the committee. My name is Dan Niffen. I'm an attorney here in Atlanta with Drew, Uncle, and Farnham. It's been my privilege to represent cities and counties for the last 30 years in a number of different cases, primarily workers' compensation. I want to start out by saying this: our cities and counties are in a unique position here. The impact of any legislation like this will fall heavily and almost exclusively on cities and counties. It will not be spread across the $1.5 billion that's paid year in and year out in our workers' compensation system. It will fall on cities and counties. I want to also say that on behalf of cities and counties, I'm not sure you could find organizations in our state that are more supportive of our first responders, our police, and our firefighters. I will start off by saying it's humbling to hear the stories that we've heard here today, to try to follow the stories that we've heard here. They're real. The need is certainly real. And as I believe our representative stated at the very outset, it's only one significant part of a mental health issue that I'm sure you as legislators are dealing with in many respects. But we're here to talk about this particular issue. And on behalf of cities and counties, let me start off by saying that we're certainly not here to say that these situations don't happen, that the need for mental health support and all the things that you've heard here today is true. The question that is not whether these folks need mental health support. They do. The question is, how's the best way to do it? Is the best way to do that to amend our workers' compensation statute in a way that hasn't been done in the 100 years that we've had it, which is to create a presumption of compensability. If you are part of a particular occupation, in this case, a first responder, you are automatically, it's going to be presumed that simply because of that occupation, if you have PTSD, it's work-related, not because of cause, not because of proof, which is the system we have now. And has been stated, I think, already today, our system now currently provides for treatment of PTSD or any other mental health issue, provided it's related to a physical injury. And I'll talk about why that is in just a minute. That's not a rule that somebody just dreamed up for the heck of it. It's been around, and for very good reasons. Our courts have talked about it extensively. But as I said a minute ago, it's important on behalf of the folks that I'm here to speak for to understand where they're coming from. Our cities and counties, for the most part, self-insure their workers' compensation benefits. The Georgia Municipal Association, the Association of County Commissioners, have created funds that provide workers' compensation benefits for the vast majority of cities and counties, and therefore for the vast majority of first responders. Those are not for-profit enterprises. They do not exist for the purpose of returning a profit to shareholders. They exist for the purpose of paying benefits, not just to a case that happens today, but so that there's enough money around to pay for the cases that happen tomorrow and the rest of the year, and that fund stays solvent. Georgia Municipal Association, just for example, in the last 10 years incurred over $80 million in benefits that were payable solely to first responders, which for them is mostly police and fire. They don't employ a whole lot of EMTs and other folks who are in this definition. The Association of County Commissioners Fund, the number of the last 10 years was $145 million. Interestingly, when you look at the numbers and the claims for these two funds and the claims that they pay out for their police, for their fire, any other first responder, they voluntarily accept, it's 94% for GMA, 96% for ACCG of all the claims that are filed by those types of employees. And I mention those numbers simply to try to buttress that the folks that I represent, the cities and counties that this legislation will impact, are not in the business of denying claims. They're certainly not in the business of trying to keep folks from getting the help that they need, just the contrary. They pay millions of dollars, $20 million a year for those, exactly those kinds of benefits. But as I said a minute ago, the question isn't whether to provide help, whether these folks in these stories that you've heard today need a remedy. They do. The question is whether it should be under workers' compensation. And has been alluded to, I think, a little bit already today, there are some outstanding remedies available that the cities and counties would say should be augmented. They are insufficient, but they don't need to be. In addition to simple health insurance, EAP programs that are prevalent and every EMT or first responder should have, there's the Department of Public Safety offices, first responder support. I don't know much, and you'd have to talk to our experts about exactly the best kind of help to provide a first responder or a firefighter or police officer who needs help after being involved in a traumatic event. But one thing I do know is that the peer-to-peer aspect of it is critical. A lot of the reason why folks don't reach out for mental health is they are fear of being stigmatized. As I think we heard in one of the stories, the firefighter who was suffering was afraid to reach out to his own fire department. The Department of Public Safety provides that peer-to-peer one-on-one counseling. It's my understanding that it is proactive. It isn't a matter of somebody reaching out. They will reach out to you. And GMA and ACCG support more funding for that program. But it's things like that that work better. They're quicker. They're certainly more cost-effective than a workers' compensation system that's going to be litigious. And with all due respect to my colleague who spoke just a minute ago, there will absolutely be litigation about these cases. You don't have to go through the statute very far to find any number of phrases that lawyers are going to litigate. What is a serious event that has to be witnessed for this to apply? What about the fact that you can file it within 3 years? How does that conflict with our statute of limitations? What about the defense? What does it mean that you have to have a scientific report that whether or not there was a pre-existing condition doesn't matter? Those are just a few that I can think of off the top of my head. That isn't going to help the first responder who's in need. And another feature of these other programs is that they're not reactive. They're not meant to be there after something has happened. They can, but they're also proactive. And it seems to me that a huge piece of addressing things for first responders is helping them before traumatic events happen, giving them the training, giving them the understanding of how to deal with these things. I don't wish to go on. I wish to leave time for some questions, but let me just end again by trying to emphasize our cities and counties want to support our first responders. They pay millions of dollars every single year in their support. We simply have grave concerns about what such a bill will do to our workers' compensation system, not just the initial use of it with first responders, but its impact down the road with other classifications of employees, not just public employees, but private employees. And especially when there are existing means that can be subsidized, can be better funded, that would immediately address this concern in better ways. So I thank you again for your attention.
Okay, thank you. Representative Jettie Lott.
Thank you to the committee for allowing me this opportunity to speak to all of you. I am not here in a position of favoring this bill or being in opposition to the bill. I'm here for something that we've talked about a good bit, but the Office of Public Safety Support in Georgia, and to answer some of the questions that have come up since we've been here. Speaker Ralston today in his speech from the floor did mention mental health being treated as physical health. If you heard his press conference today, that is a very big deal. We are all on board with that, and the speaker has done an incredible job bringing a group of people together to come with this mental health legislation. And I'm excited to see where this goes, but I'm pretty sure since the speaker's almost carrying it himself. It's going to do well in the House. So I'd like to say I can't wait to see that, but I would like to remind you all or inform some of you that may not have been here at the time. In 2018, Governor Deal signed HB 703 that created the Office of Public Safety Support, which is a division of the Department of Public Safety. And in 2019, we here, along with Governor Kemp, of course, we funded that agency. That agency was created to change the narrative, to remove some of the stigma, and to create the Office of Public Safety Support, which is a peer-led program for mental health for our first responders. It was our own Appropriations Chairman, Terry England, originally in this state. Peer support was being done. It was being done on their own as collateral duty through GBI and the Public Safety Department, Corrections, DNR. They had all put out officers, had them trained in peer support for mental health. They were working for years. They had their first post-critical incident seminar in, I think it was 2013, which is a 3-day sort of a bigger, for those folks that one-on-one in the workplace was not working, or they needed a little more help. They had post-critical incident seminars. They ran those for years, successfully helping first responders in Georgia, and then came to the state of Georgia and said, can we create this department? And we did. And it was unanimous in Public Safety Department, in the committees, both in the House and the Senate, and on the floor in the House and the Senate, unanimous votes to do that. So now today, Georgia has the Office of Public Safety Support. And to answer some of the questions that did come up, which are interesting, when we had those hearings, they were very similar to the hearings today. Everyone that spoke was exactly right, and suicide is very prevalent in the first responder community, and the needs in there are great. But I want you all to know that the Office of Public Safety Support is not being utilized to its full value. And it was just this weekend that we were blessed to be invited to the Cities United Summit to speak to the mayors. I know that they have spoken, their agency directors have spoken to the chiefs of police, and to the sheriff's associations. And the word is just getting out because, of course, it was funded in 2019. So we just started this program. We are trying to get into, but it's every first responder in Georgia. That includes our dispatchers, our EMS, our firefighters, and our law enforcement, including corrections and HERO folks. So they give the speech much better. I'm doing it just as one of the sponsors of the legislation. Just to tell you how fantastic this program is, that it has been doing great things in Georgia, that they do actually have licensed clinical social workers, that they do actually do some level of treatment on the folks along with one-on-ones. After officer-involved shootings, they go to the communities where those have happened at the request of the local agencies. They do debriefings. They work those agencies as groups. They work one-on-one. Anytime that they are called, they are very aware of the needs in the first responder community. And they are really, really pushing agencies and first responders to step back from that stigma. So I would love to take any questions you may have. I know that I went really fast, but my primary reason for being here is to make sure that we are utilizing what we have in this state currently, and we're using it to its full value. I would also just like to add that a secondary movement was made in Georgia to create, and I know, again, this had come up in the House just a couple of years ago. We had a big conversation about something called Valor Station. It is not up and running, but Valor Station was a donated property in Augusta, Georgia. And the attempt was a nonprofit creating a first responder only nonprofit mental health and substance abuse facility for active duty first responders. And it was brought up in one of the previous speakers, going home and drinking. Drinking is the primary one, of course, drugs as well, but we wanted to have another option. And so we've been fighting. Not only did we create the Office of Public Safety Support that the state is involved in, but the same folks have moved into this nonprofit world to try to get to the next level where we've got something else to offer. So we are not asleep at the wheel on this, and this is an incredibly important issue, but I just want to make sure that the folks in the room know that we've got some things out there, including what the speaker has brought forward today.
Okay, you've got some questions from the author, Representative Kennard.
Thank you, Representative Lott. Thank you, Chairman. It's my understanding that there's 135,000 first responders in Georgia. Do you know what the size of the staff of the office that you're speaking of?
I don't know. There's a lot, it's mostly collateral volunteers. They have trained them. They're specific folks. So the staff in the Office of Public Safety Support, I don't work for them. I just carried the legislation. So I'm not sure how large they are. I know they did mention it when we were at Sunday at the Cities United Summit. They mentioned their staff size, but their fingers are everywhere. And any agency that has an individual that they believe would make a good peer, there's a training process for that. So this is getting the awareness, creating awareness. And that's one of the reasons I'm here, exactly, because we are not utilizing this to its full potential. And the peers are throughout Georgia. And so, yes, please, if you have an agency that hasn't used them, doesn't know them, please let them know, share the information that is out there.
It's my understanding that there's 9 on the staff. And there's 2 clinical social workers.
9 paid employees, if that's the number, but that's not the network. And they've only existed since we created the office under Department of Public Safety, but the peers have been doing this for years. As a matter of fact, Director Westhorn, they're in a post-critical incident seminar this week. And maybe it's ending today. I know they were there Sunday, heading out Sunday for that post-critical incident seminar. I have had the opportunity to sit in on one of those. And on the one that I went to, there were probably 30 peers around, and there were close to 25 or 30 participants. And so the peers are from all around the state, and they're from all the agencies.
One more question. Okay. So is there any quantifiable numbers of the number of suicides that this program has stemmed, even though we know these suicide rates are continuing to climb? So the efficacy of this program, I have to question.
Well, I will say this. So it's a new program as far as the 9 paid employees and the state actually having any funding for it. They ran a gun raffle and a concert in Augusta, Georgia to pay for the post-critical incident seminars, 2 a year that they did from 2013 up until we passed legislation. So they did this on their own, and all of the agencies loaned out their peer support folks. I do know that we have, I only know this because I kind of am close to some of the folks involved, but I'm not an employee. I'm just someone that carried legislation. But I will tell you, I could tell you a number of stories where, including one in Augusta, Georgia, where at an event, somebody said, I can't do this anymore. And it was a law enforcement event. And immediately, because there was a peer trained person in the room, that person was taken out, held by the hand. And we got one of our other peer counselors, and 2 counselors, actually, they themselves drove this person to, I think, Alabama, I'm going to guess at that, but wherever there was an inpatient facility, they got them a place to go.
So the funding for the lives of our first responders is contingent on a raffle?
Was prior to the Georgia General Assembly and the governor, and putting Office of Public Safety Support as a priority. We made first responders a priority, I think, really for the first time in 2018. I think, and the conversations were very similar to these conversations that we've had here today, legitimate needs. And so, yes, we are just starting this program. And the point of me being here is to make sure that every agency, every person, every mayor, every neighbor, everybody knows that they exist so that we can get the care that they need.
Okay, Representative Carpenter, Chairman Carpenter.
Yeah, you can say representative, you can say whatever you want to. Leader Lott, quick question for you. Would it be fair to say that you have championed this issue, and that if you had your preferences, it would have probably even had more funding than it actually has received so far?
I would always say yes to that. Yes, absolutely. I would. But I will tell you that our biggest weakness right now is we're still working to get the word of mouth out. I mean, it is really, truly, it's still in its infancy. And so it's really what brought me here today. His bill has given me an opportunity to stand up to tell you, someone mentioned that the families are not cared for, but yet that is not true in this PCIS that we are in currently, that is happening right now in South, on the coast. Families are absolutely included. And the one that I went to, it is entirely, the families are included, even if they don't go to a post-critical incident seminar for 3 days, even if it's just an event and the team goes to that community. If there's a need to meet with the family, they do that. So at the post-critical incident seminar that I was at, it was many husbands and wives side by side, because they absolutely deal with the family, and it is a big deal.
Sorry, you're okay. I just remember very vividly a conversation we had one day about you just fighting tooth and nail to support this program and to fight as hard as you could for funding. And so I think you come at us with a clean hand and a clear heart, and how much you love this program. And I think
Indeed.
to grow it would be a great thing.
Thank you.
And I actually served with Jody on the public safety and was there when that bill was being, much like this room, and like she said, everyone's very passionate, and it's been a great thing. We've got a couple more questions. Is that Hill? Yes. Okay, Representative Hill.
Thank you, Representative Lott, for bringing this to our attention. But my concern is, how are we going to get this out to the 159 counties, the number of cities that's out there, so they know about this being available to them?
So a random representative shows up at the podium and starts to tell the story. Our cities have invited us to speak to our mayors. I need my representatives to know about it, to bring it to their homes. I need my senators to know about it, to make sure that they can be advocates for this program. I think that there are a whole lot of things that we can say. We want to help the first responders, but financially, someone did bring this up, but it really helps the cities too, to not, the turnover, and that came up in our committees when we were running this. At least Georgia State Patrol, a number came out that it was near 90,000 to train someone. Well, when you lose them to, not being able to come back, because they just choose not to come back because this is too stressful. So this program, it keeps them healthy. It keeps them coming back to work, and it really keeps your city safe, because when you're called out and you've been up all night, suffering with the dreams, the nightmares, the next day, you're not going to be at your best. And when you're not at your best, that's when mistakes happen. And when mistakes happen, somebody's coming for the cities and saying, look, your people are failing and we're going to get you for that. So there's just a benefit all the way around to have everybody in their best state of mind. And so we're going to continue. I keep saying I just love this program. I don't work for them. I want to. No, I just think it's fantastic. I think we all need to just go to every event we can and make sure everybody knows about it, and spread the word. And that's really where we are. That we are just starting this. I can't wait to see the impact from Speaker Ralston's, mental health legislation, because I think that's going to matter too. Mental health being treated as physical health. So there's just a lot of great things that are happening, but we are not ignoring this conversation.
Right. And I would say I talked to the appropriations late a couple of nights ago. And they're well aware. And one of the discussions we had, just to kind of answer the question, we are delving into the number of staff we have and how busy they are. And if we need to double or triple it, and again, with the emphasis and Speaker Ralston's backing, you can better believe that's going to happen. But the first question is not just how many people do we have, but how many do we need more? So anyway, those discussions are already started. El Mahdi's been waiting for a while.
Thank you, Mr. Chairman, and thank you, Representative Lott. I think we, as it certainly has been expressed here, we appreciate your work to provide this Office of Public Safety support. I've kind of my background, having worked I've written probably a good 10,000 or so arrest warrants for a courthouse just a hop and a skip away from here. And certainly I know for the police agencies we work with that, this is something that's very important. I was curious, though, to the point of my colleague, Representative Hill, that for the 159 counties, just alone, looking at the sheriffs, the police agencies there, the firefighters, EMS, and then, of course, those who are in the jail system there. There's so much for them to make sure that they have to get the services necessary because we expect them to be back out on the street. And while I appreciate the effort that you put towards your program, but if we're looking at this, is it possible that maybe with your program being in its infancy and that it's good for in local areas where they can, do a raffle or like a bake sale to kind of be able to pay for these necessary services, that quite possibly the funding that may be available in this budget in order to cover for your agency, that this here actually, by having this go forward, wouldn't actually deprive your program that you worked on of the funding necessary, that this would actually be very complementary to that regard. Would you agree?
So I have to clarify.
Okay.
The bake sale, no, the lottery and the concert, that was prior to the state of Georgia getting involved. So now we actually have a committed budget. It's a budgetary item. It is a division of public safety. That was how they began helping first responders on their own. All of the agencies sent folks, but to have these post-critical incident seminars where folks stayed overnight, where they were fed, they had to raise the $30,000 per event. They did that themselves. And they did that for years, which is how we got here. You're asking me whether or not it complements. I really was not here to judge that, and nor is this my committee.
Okay.
I wanted to make sure that you did know, though, that we are out there with some services that we can provide. So whatever the decision and the will of the committee is on his legislation, it's just important to know that when you do hear a lot of these stories, it was prior to the state of Georgia having some of these resources available to them. And I just want to make it very clear that we have these resources now. They're open to every first responder in Georgia. And no matter the agency's size, there's someone out there that will come to take care of some of these mental health needs. If you recognize them, if you request help, if you see someone that needs help. And sometimes, and I think one of the big important things, it's not specifically one critical incident. It could be a cumulative effect, and you just watch somebody somewhat deteriorate, and you're watching that. As soon as that's recognized in any of these agencies, there's somebody you can reach out to.
Thanks for that clarification. And just particularly now, how much funding has actually been segregated for that program the last budget cycle?
On the original, I'll give you the original because I have not looked just at this one, but it was $1.5 million in the original.
Okay.
It was to create a division of public safety. It was a new division. So yeah, so we had to obtain the vehicles, the staff.
Gotcha. Okay.
The whole thing.
1.5 million.
In the original.
All right, we need to bring this in for a landing. Representative Hill. All right, y'all be quick.
Jody, how do we get in touch with these folks? Who do we contact? What's their number? Can you get that to us?
I absolutely will get.
Thank you.
Yeah, I'll email the
Without a doubt.
committee. Yeah, I'll email the committee. Last one,
Great
the author, Kennard.
Representative Lott, I do appreciate your advocacy for this program. Would you not agree that if a police officer gets shot, that they would need a lot more than peer support?
So again, they have licensed clinical social workers. It's a bigger group than just someone else in law enforcement that's taking. As a matter of fact, in their original core group, and now he has left to move on to assist the Valor Station portion of this conversation. He was a longtime Georgia State Patrol trooper that went back to get his licensed clinical social worker degree. So yes, it does require more than just peer-to-peer, and it does have that. Yes.
Okay. Tom Kirby's been waiting a while online.
Thank you, Mr. Chairman. First off, I certainly want to thank those that came here and testified and shared their stories with us today. And I think we all heard them loud and clear. Thank Representative Kennard for bringing this legislation to us. I think we all got a good understanding of what it is that we need to fix. And it's definitely something we need to fix. And as we move forward, I want to make sure we do it right and fix it right. And what I would really like to see is the next step. And I believe we have the authority to do this, or you do, Mr. Chairman, is let's get this to the advisory council. They have been very good at vetting through legislation to make sure we get the legislation right, so it fixes what we're trying to fix, and we don't go down some rabbit holes that we don't need to. So I would like to suggest we get it to advisory council, and also when you talk to them, tell them time is of the essence. We want to hear back from them as fast as they can get to us. So to make sure we've got the right legislation to fix and address the problem we're trying to address here. So.
Thank you. And I do have the authority to do that. And that is the direction we're going to move. We both have the State Board of Compensation judge here. Raise your hand, Judge Vinson. He also oversees a 110-member advisory council. Bobby Potter, raise your hand, who oversees. So I think y'all have heard the mandate loud and clear. It has always been, this is not a delay tactic. It has always been the position of this body before any changes are made to the workers' comp, no matter how slight it may seem. We do vet that through the advisory council. It's a 110-member group that is made up of subject matter experts divided into whether it needs to be medical, claimants, lawyers, insurance. I know I'm leaving some out, but anyway, that is what we're officially doing now, is sending it to the advisory council, not to wait for an annual meeting or whatever, but the mandate is let's hear back from you in what direction we need to go. Okay. And with that,
Mr. Chairman, am I still on?
Thank you all.
No.
What's your name? Okay, come up real quick. You were not on the list.
Thank you very much for letting me jump up here and speak. I will be quick, but I do think my story might share some relevancy, even more so in light of the last two speakers. My name is Chad Burr. I'm a captain with the Gwinnett County Fire Department, where I've worked for 17 years as a firefighter paramedic. Before that, I worked here in Atlanta with Grady EMS, and I've also served as a critical care flight paramedic. So in almost 20 years of public safety, I've seen some pretty horrendous things. In 2009, I joined my department's Critical Incident Stress Management and Peer Support Team, referred to as CISM. And since 2015, I served as our team's coordinator. I find that much more relevant in light of the last two speakers. I'm very, very passionate about peer support. I teach it. I'm certified through the International Critical Incident Stress Foundation to teach it. Its intent was not to be definitive care for mental health. It is a tool in the toolbox. It's a great tool in the toolbox. We can certainly help people. We can certainly save lives, and we can improve the quality of life, but it is not intended to be definitive care. It's much like a paramedic to an ER doctor. We can go out, we can administer albuterol, and we can save somebody with asthma and they're fine. But at the end of the day, we can go out and run a gunshot. We might be able to provide some mitigating measures, but they need a surgeon. It's much the same with somebody suffering mental health. Peer support can go out and help mitigate some of the crisis, but they need mental health. Somebody who is going to go down that path of PTSD, a peer is not going to be able to manage that. It's out of our scope, and it was never intended to be that level of care. In that role of the coordinator of our peer support team, I've had the honor to talk to a lot of people in public safety dealing with various mental anguishes. Some of them are very mild. Some of them just need to talk. Some of them need more deliberate intervention. I've actually picked up the phone and contacted a mental health professional for one of our coworkers. Working in a physically demanding job, such as ours, such as law enforcement, it's very nice to know we have that support. If we blow out our back, twist a knee on the job, that we're going to be covered for the long-term care through workers' compensation. But right now, we don't have that sense of security when it comes to the mental stresses of the job. And make no mistake, I think y'all would all agree, it's a mentally stressful job. One of the most common questions we receive as first responders is, what's the worst thing you've ever seen? In 2005, I saw that worst thing that I've ever seen. I was a rookie firefighter. I was a lead medic on Med 11, and we responded to a 3-year-old that had been run over by an ice cream truck. Her head was crushed, blood was pouring down the street. She was dead. The body just didn't know it yet. And we did everything we could. We tried in vain to save this little girl's life when the family stood by, and we had to watch them as they suffered. I was the lead medic. I rode in on the ambulance with this patient. She died en route to the hospital. Nothing I could do. I felt a sense of hopelessness that I'd never felt before. And at that time, I really didn't understand what kind of emotions and reactions I was having and how I should best go about them. In hindsight, if I had better education and if I saw a light at the end of the tunnel, if I knew that coming forward, I would be protected and covered for the long term, I think I may have done that. And I know plenty of other people that if they felt that sense of protection that this bill would provide, they too would also come forward. I've talked to plenty of people that have come out of pocket thousands of dollars because EAP, while it's a great resource, didn't help them. They needed much more than what EAP offers. Our department, it's 4 free sessions, and they say, go find your insurance and go find a provider. That provider may not have a specialty in first responders. And it's very, very important for us to find somebody that we can actually relate to and relate to us. So I dealt with that for quite a while. Over time, you start to get agitated at everything. You start not liking going in public places. You start fighting with your wife, and all of a sudden the stress from the job becomes stress at home. And it snowballs into a very, very big problem. You think you'll get over it, but you won't. Okay. It's a very deep, dark secret that you don't get over those types of things unless you deal with them. Finally, you start to think that the only way to get out of it is death. And in March of 2012, I was 5 pounds of pressure away from dealing with my anxiety and depression. I had a 9mm handgun to my head, praying for the strength to put it down and get help. I'm lucky. I'm much more lucky than most people, than several people. I put the gun down and I called my doctor. And since that day, I've been on medication for anxiety and depression, and I'm not ashamed to admit it. I too have aspirations to go far in my department. And frankly, if that's going to hold me back, so be it. But I'm here to speak on behalf of other first responders that may be in a similar situation, but not feel safe enough to come out and say it. Mental health is health. It should be treated the same way that a torn ACL or a back injury should be. I don't understand this disconnect between it not being the same. How can we expect the stigma to change if at a policy level it's treated so differently? No wonder people have a reservation to come out. They look and say, well, you sprain your ankle, you're covered, but why won't they cover a mental illness? How can we expect the guys on the ground, guys and girls on the ground, to come out and start seeking the help they need? This bill will open doors for first responders, and it will provide a light at the end of the tunnel. This bill could save lives, and it would be an extremely valuable tool in the toolbox of mental health. Thank you very much. I'm taking any questions if you have them.
Yeah, thank you for being served. I'm sorry, and I usually ask, was anybody not on the list that should have been on the list? Any hand raised? Okay, with that, we're adjourned.